morning, everyone. Welcome to my 6-month progress report. My PhD thesis title is The Relation Between the Maternal Factors and Birth Defects. My name is Zihan, and I'm a biostatistician and currently working in the Department of Obstetrics and Gynecology at Semmelweis University. My mission is to provide closer maternity counseling to provide the birth defects, and my vision is to increase mother awareness and education and make the fewer birth defects. Currently, I have two specific goals. The first one is investigating the association between the maternal risk factors and congenital birth defects, which started from September. And the second one is investigating the association between the maternal medications and congenital birth defects, which started from November. Let's start with my first project, investigating the association between the maternal risk factors and congenital birth defects. Congenital birth defects accounts for 1% of prevalence in newborn babies, which is the leading cause of newborn deaths. According to the data from the European Registration and Congenital Anomalies and Twins, for the severe congenital birth defects mothers, only 40% of the mothers receive a prenatal diagnosis, and only 20% of them do it before the 25 weeks of gestation. Up to 30% of the congenital birth defect cases are associated with the marginal environmental factors. We aim to identify the marginal risk factors that are associated with the congenital birth defects. Our clinical question is, what marginal environment factors are associated with the risk of the congenital birth defects? We use a PECO framework to design our study. The population are the pregnant women, and exposures are the marginal risk factors, and the comparison is the absence of the risk factors. The outcomes are the congenital birth defects. We make a hypothesis here. Some marginal factors will increase the risk of developing congenital birth defects. We conduct systematic research on November 16, 2023 in 3 main databases. The search key has been divided into 3 domains. The first domain is the pregnant mothers and its synonyms. The second domain is the risk factors and marginal exposures. The last domain is congenital birth defects and the 10 most common phenotypes. After the 2 cycles of the article selection, we got 100 eligible studies. Additionally, we got 19 eligible articles from the reference chasing. Now, we finally got 119 articles in total. At this moment, we have finished the preliminary analysis on the obesity, undernutrition, and diabetes. However, due to the time limits, I will only present the forest plot on of the obesity and the pre-pregnancy diabetes. This slide shows a forest plot of the obesity. The marginal obesity was identified by measuring pre-pregnancy BMI value of the mothers. The cutoff value for the obesity is 30 kilogram per square meter, and for the normal weight is 18.5 to 25 kilogram per square meter. In this forest plot, we included 19 articles and 300,000 obese mothers and near 1.44 million mothers with normal weight. As you can see, the I-square is 73%. That means this analysis is in the high level of the heterogeneity, and the potential source of the heterogeneity is because the various cutoff value of the obesity and the different study types. The overall odds ratio is 1.23, which indicates the obese mother, or the newborns of the obese mother has a 23% higher risk of the congenital birth defects than the mothers with normal weight. And second forest plot is the pre-pregnancy diabetes. The information on the pre-pregnancy diabetes was derived from the self-reported data or the medical history from the hospital databases and the patient registry. The I-square of this forest plot is 87%, which indicates a high level of heterogeneity. The odds ratio is 2.91, which suggested the mothers with with pre-pregnancy diabetes are near threefold more likely for their offspring to have the congenital birth defects compared to the mothers without the pre-pregnancy diabetes. This study has some strengths and limitations. For the strengths, we included different maternal risk factor categories for the congenital birth defects, and also we include high number of the included mothers with their infant pairs. And also we use the rigorous methodologies to conduct our meta-analysis. And for the limitations, there are so many different cutoff values in some studies, and also in some studies they use a self-reported outcome to do their assessment, and also in some studies they don't consider their confounding factors. So that should be the potential limitations. In summary, maternal obesity and pre-pregnancy diabetes increase the risk of the congenital birth defects in their offsprings. This study may improve the pre-pregnancy counseling and the pregnancy care. And also, we suggest our future researchers to do the longitudinal studies and the population-based studies. For the first project's progress, we finished all the data extraction and the risk of bias assessment for all the risk factors other than air pollution. But we also need a consultation meeting with the expert in the air pollution field. The second project is investigating the association between the maternal medications and the congenital birth defects. This slide shows the most common maternal disease during the pregnancy in Hungary. For example, the cardiovascular disease, mental health disorders, and infections and inflammations. To treat these health problems, this table shows the most common medications taken by Hungarian mothers during the pregnancy. We aim to investigating the association between the medication intake in the first trimester of the pregnancy and congenital birth defects. Our clinical question is, what maternal medications are associated with the risk of the congenital birth defects? We also use the PECO framework to design this study. Compared to the first project, we have changed the exposure and the comparison group to the exposure to the specific maternal medications and no use of the specific maternal medications. And other elements are kept same. We make hypothesis here. Some medications during the pregnancy will increase the risk of developing the congenital birth defects. This study may contribute to we provide the guidance to the healthcare providers on the medication management, risk counseling, and enhance the prenatal monitoring for affected pregnant women. The preliminary research was updated on the February 29th, and for the search key, it's also divided into 3 domains. We changed the domain 2 to the medications and its synonyms, and the other 2, and the domain 1 and the domain 3, we keep same compared to the first project. In summary, I have 2 ongoing projects. The first one is investigating the association between the maternal risk factors and the congenital birth defects, which we plan to submit in the May of 2024. And the second project is investigating the association between the maternal medications and congenital birth defects, which we plan to submit in September 2024. Thanks for your all attention. I would end this presentation using my personal quote. He was an active nature and yet fond of learning, and he was not ashamed to ask and learn of his inferiors. Thank you for your listening.
Zihan, congratulations. Not only your progress is great, but your emotion to the topic, it's amazing.
Thank you.
Is there any question from the floor?
I would like to ask regarding your first project, whether these articles you investigated differentiate between visceral fat and subcutaneous fat, subcutaneous obesity and visceral obesity.
I think should be the risk of the pre-pregnancy obesity. Yes, if I can understand correctly, so maybe you can.
I'm just wondering whether these articles you investigated differentiate the different kind of obesity.
Yes, we have included different types of obesity. For example, type 1, type 2, and type 3. They are based on different BMI values. However, I didn't present in this presentation, but we have a subgroup analysis. But for this kind of the different types of the obesity. So yes, my answer is yes.
You used BMI as well for the obesity assessment, right? Okay. But my question would be, why did you choose not to include the covariates, the variables, the confounding factors in your analysis? Weren't there any adjusted analysis in the original studies that you could use?
Well, I think for the meta-analysis, we just use the final result from others' articles. Some articles, they have involved the confounding factors to get their final results, but some studies, they don't do that. So, of course, in my project, I will confounding the demographic other factors to modify my model, but at this case, I can't do anything to modify that effects without the confounding factor adjustment. So
okay.
Yes, so that's also the limitations or maybe some bias to get this.
Thank you very much.
Yeah, thank you.
Thank you, Zihan, for your presentation.
Thank you.
I have one question. Among the studies included, did they specify what kind of congenital heart defect? Could you subgroup maybe the different to know what is the most common cardiac malformation associated with obesity?
Yes, exactly. We include 10 most common phenotypes of the congenital heart defects based on previous literatures. Yes, so we will do the subgroup analysis. So it's a very huge forest plot, and it should be the nightmare for the statistician. Yes, so we will do for a subgroup analysis, but it should be in the later. At this moment, I just show the overall the congenital heart defect. That means if the patient has any types of the congenital heart defects, so we will involve in our model. But I believe we will do the subtypes analysis.
Yeah, that would be great to see as well.
Yes.
One more question. I saw like a huge difference between, for example, the first study and the last study. Maybe that's also connected to Isabel's question. Like why? Because the first article was a healthy woman had more cardio malformation, their babies, compared to the obese woman. Did you find any reason behind that in the first study?
To be honest, no. But I think we have in our draft writing, we need to discuss these potential reasons for why the obesity can cause the higher risk on the congenital heart defect. We need to investigate the pathological articles to try to find the maybe biological signaling of these risk factors. But I will do it later. But I think it's also a good point to make my article fulfilled. So yes, thank you very much.
Congratulations to excellent results that are very interesting for me, especially the diabetes one.
Mm-hmm.
I would like to ask if there was any information in the literature about how well was the diabetes controlled and what were the rates of malformations.
So you mean the obesity control?
No, the diabetes. How well was the glycemia control in these patients? And if in the patients with worse control, glycemia, if there were a worse outcome for the babies?
Actually, they didn't mention so much. Yes, actually, unfortunately, they didn't mention so much. But I think we can make some changes in our project to cover these issues. Yeah, I think so. That's also the strength to our project. How to make our projects with a normal point compared to other results, other articles. So that's a good idea to do it in my project.
Thank you.
Thank you.
First of all, congratulations. And I would like to ask a question regarding your second project. So as far as I understand, the exposure is the take of supplements and medications, and the control is not taking any kind of medication. I'm just curious about what about folic acid or these kind of minerals and vitamins. Did the control group did not get any kind of medication or supplementation in these cases?
Yeah, I think so for the folic acid. Actually, I would like to summarize in my first project. However, there's hundreds of article study for the folic acid. So I would to put in the second project and make the control. That means no use of the folic acid during the first trimester. That means the first 3 months of the pregnancy. So that is obvious because in their medical history and some questionnaires, maybe some recall bias, but they could remember whether they used the folic acid during the first trimester. Yes, thank you.